Everyone right to go? Yep. Look, thanks very much for joining us. Everyone right to go? Look, thanks very much for joining us. Since yesterday, late yesterday, when 2 additional cases were notified to the community, we've had a further 6 positive cases. That takes the total number of cases in Victoria directly linked to those Sydney incursions to 24. So 24 positive cases in total. We never want to see more cases, but it very much, I think, underscores the need to have the lockdown. It very much confirms the decision, as difficult as it was, that we took yesterday to lock the state down for these 5 days. These additional cases, if they had not been in a situation where we're limiting movement, then we know what that means. It means we finish up with this running wild. We now have 100 exposure sites, 1,500 primary close contacts, 5,000 secondary close contacts. We are out to 7 rings in terms of contact between cases and everybody that they have spent time with. Our contact tracers are working really hard and really well. I want to give them a shout out and thank them. So too the Victorian community, coming forward, getting tested, following the rules, doing the right thing. Nothing's more important than that. Each of us have a contribution to make. Each of us have a part to play in not just our systems and our processes running alongside this virus, but in fact getting ahead of it and being able to crush it. We've done it before, and we've done it before with the Delta variant. We can do it again, and we will do it again. We're all working as hard as we possibly can to make this as short a lockdown as possible, 5 days. That's certainly better than 5 weeks or 5 months. But as I said last night, Jerome and me and all those contact tracers and everybody else in the team, we can't do it on our own. We need, and we're asking for every single Victorian to play their part in that. And as we have done before, I'm very confident that Victorians will rise to that challenge. Now, a couple of things I wanted to update you on. Firstly, yesterday I indicated that we as a government were very pleased with the announcements that the Prime Minister had made in relation to support for those who would be out of work, would have reduced hours if it were not for this lockdown. This lockdown is causing them some very significant financial pain. I also made the point that that need in a needs-based system began hour 1 of day 1 of our 5-day lockdown. There was a couple of unresolved matters, and we left it to some conversations between the PM and I last night. Very pleased to say, and I think the Commonwealth have made announcements to this effect, but they were very positive discussions, and we will see a situation where those rules will apply regardless of the fact that, and those benefits will apply, those payments will apply regardless of the 5-day lockdown as opposed to the 7-day trigger point that had been foreshadowed by the Commonwealth. If you lose the hours and you are eligible, then the length of the lockdown doesn't matter. You've lost those hours, you've lost those wages, and you should be supported. The second part of that's a great outcome, and I'm very pleased to be able to have those very positive discussions with the Prime Minister last night. The second point, though, is those arrangements, as was always the case, they relate to the Commonwealth declared hot zone. So that part of the state, which I understand is both Greater Melbourne, Geelong, Queenscliff, the Surf Coast, but also Moorabool Shire. They will be picked up. Those payments will be paid for by the Commonwealth. I can announce today that the rest of Victoria, which is under lockdown but is not Commonwealth declared, and again, we're not finding fault with this, but as part of the agreement, and indeed as was foreshadowed earlier in the week, we will pick up the tab for all of those eligible workers who are paid. So the Commonwealth, through Services Australia, will administer that system. They will then send us a bill for those regional workers. It's important that everybody across the board gets the support and the care that they need. As I said yesterday, it's not really a cost to the budget. It's an investment in everybody doing the right thing. It's an investment in avoiding hardship and an investment in making sure that we can contain these 2 outbreaks and get this back under control and open up and be as close to normal as we can be in this pre-fully vaccinated period. The second point that I foreshadowed yesterday is that we would waste no time in providing affected businesses with Minister Pakula is here with us, and he's going to take you through the details of this package. It's more than $200 million. It is instant, so it is on foot from pretty much now, and we're looking to make automatic payments, so people will not have to apply. If you got a grant last time, you'll get a grant this time, and you will receive those monies. We'll pay them almost certainly before the end of this lockdown, certainly early next week, and it'll be then a matter for your bank and your financial institution as to whether that money flows to you overnight or over a longer period. But we will have made the payment as quick as possible. We're wasting no time with that. That sense of shared effort is part of the partnership with the Commonwealth Government, and it was important that we clarified for the Commonwealth Government that yesterday, and that's why we're able to announce those positive partnership details, those arrangements for both business and for workers. Essentially, I know and understand that this is not easy. No one wants to be locked down, but we had no choice, and these additional cases overnight, and particularly some of the context of these cases, I think confirm for all Victorians that we had to make that tough call. We have been here before, we have done this before, and we've done it with Delta. Let's never forget that. Just the last time we were able to bring, I believe, a more complex series of chains of transmission under control, and I'm very confident that our contact tracing team, in partnership with every single Victorian playing their part, will be able to do the same again. In the interest of time, I might just now throw to Martin to take you through the details of the business support package, and then Jerome can speak to these additional cases, and then we're happy to take any and all questions you have.
Thank you, Premier. I'll explain the package in the context of the Business Cost Assistance Program and Licensed Hospitality Venue Fund from the last lockdown in May, June. So that was a $460 million package, of which we've now paid out $414 million to 86,000 businesses. Every one of those businesses will receive an automatic top-up, 3,000 under the Licensed Hospitality Venue Fund and 2,000 under the Business Cost Assistance Program. The events package that we announced still has capacity in it, so any events that are affected over this weekend, they'll be eligible to make application under that package as well. And of course, last time we announced support for Alpine Resorts, which was capped between Alpine Top-Up and B-Cap. That cap will increase by the value of the support in this package, so that the payments to those Alpine industries won't be absorbed by the increases that we're announcing here. So 413 or 460 million has already gone out the door. All of those businesses will receive payments again. I should also make the point that there are some 22,000 businesses whose applications are still being processed because more details are being sought. Not every application is as simple and as straightforward as every other. So in regards to those, we would expect those all to be resolved early next week, but they revolve around things like ABN details not being consistent with what's on the record, ANZIC codes and things of the like. So some of the more complex cases are still being resolved, so that will ultimately increase the number of businesses paid out under the last scheme, and consequently will increase the number of businesses that receive an automatic payment under this scheme. I'll now hand over to Jerome.
Thank you, Minister. Good afternoon. As the Premier said, there are 24 active cases of coronavirus in the state at present, associated with the two incursions, two chains of transmissions that we're following through. That's an increase of 10 on yesterday, including the 4 cases we discussed at various points during the day yesterday. I'll give an overview of all the cases, and then we'll go to questions. There are currently 3,095 primary close contacts across all those cases, and about 3,500 secondary close contacts. Those numbers, of course, continue to evolve pretty much every hour. We now have 126 exposure sites. For the City of Hume outbreak, that continues to be an outbreak of 5 positive cases. That hasn't changed. 220 primary close contacts. Over half of them have now returned a negative test result, and we continue to work with that cohort to continue their testing program and isolation protocols. For the aerial apartments, we now have 7 positive cases in total. That is an increase of 1 on yesterday. The one additional case is a personal close contact of one of the positive cases in that apartment building. There remain 106 residents on site at Aerial Apartments. 104 of them have returned a negative test result. All positive cases have been moved into hotel quarantine a few days ago. A total of 19 people in Aerial Apartments, either positive cases or close contacts, have moved into alternative accommodation. And my thanks again to the entire community in the Aerial Apartment building for their ongoing stoicism as we go through this isolation period. We then have a cluster of cases, of 6 cases around Barwon Heads. This was a man who joined his friend from the Marylebone Apartments at the footy game. He in turn has 3 household contacts who have all turned positive, family members. That is an increase of 1 on yesterday, a close household contact. In addition, we now also have 2 staff at Bacchus Marsh Grammar, work colleagues of that first index case. It's a total of 6 cases associated with the Barwon Heads group. Now a total of 916 primary close contacts associated with that, particularly Bacchus Marsh Grammar. We continue to do a lot of testing with the school community there and Barwon Heads Primary School. And can I just shout out to Barwon Heads Primary School? We saw 754 tests done yesterday during the course of the day, some dedicated tailored testing arrangements for the school community. And I thank the whole community for their support in our investigations. We now have 4 new cases at the MCG reporting on yesterday. We discussed some of these yesterday, but let me go through them again. We have a child who was in a different part of the, all part of the MCC Level 2 Reserve, but all these 4 individuals are not known to each other and are not known to the 2 other people that we know were in the MCC Level 2 Reserve, including the index case. So we have a child under the age of 10. We have a man in his 30s who's a staff member at Trinity Grammar. This individual also has an exposure at the Wallabies game at Amy Park a few days later. We have a man in his 20s from Montmorency and another man in his 20s from Point Cook who works at the Sanctuary Lakes Hotel. All these individuals have other exposure sites. In the interest of time, I won't go through them here. The details, of course, are on our website. We also have 2 new cases associated with Young and Jackson, the pub across from Flinders Street Station. Both men in their 30s, one who lives on the naval base, the Cerberus Naval Base, and one who's an office worker in Richmond. We have a full response, and thanks to the ADF for the response around the naval base. A lot of testing undertaken there yesterday. Also a very high vaccination group at the naval base, and we continue to work with them. We have a total of 207 primary close contacts currently associated with the Young and Jackson's pub. Of course, it was match day, so a very busy time. We expect those numbers to continue to rise, and obviously a lot more testing underway there at the moment. In terms of vaccination status, across those 24 people, 1 is fully vaccinated. That's one of the new cases from today, the social contact from the Aerial Apartments. 4 of these individuals have had 1 dose of AstraZeneca. We have updated our guidance for exposure at the Carlton Geelong game, and my thanks to the AFL, Geelong Cats and the Blues for helping us contact their members and other people who are at the ground to reinforce the testing protocols. We've expanded our Tier 1 site across a more significant area of the Level 2 of the Members Reserve. So if you were in the Members Reserve for the Carlton Geelong game last Saturday, you would have got a text from us, a message from us to come forward and get tested and to isolate for 14 days. There are other parts of that Members Reserve that continue to be Tier 2 exposure sites. We would encourage anybody who went to that game, if you've got any symptoms whatsoever, if you've not heard from us, we'd like you to come and get tested, just out of an abundance of caution. It's very important to us. We are confident of the controls within the ground. We know there is mixing outside the ground. We're very keen to make sure we've got you covered. We also have identified, obviously, a number of exposures on public transport, particularly trams, moving between the MCG and Flinders Street, Swanston Street, both before and after the game. And of course, as I've said earlier, anybody who was at Young and Jackson's, we have 207 people identified, thanks to the QR code system. But if you were at Young and Jackson's and you didn't sign in, please come forward to get tested. We have at least 4 people who are now active, who are 3 of whom we believe probably acquired the infection at Young and Jackson's. We need to make sure that you're not one of them, so please come forward to get tested. We've obviously worked closely with the ADF to lock down the naval base at Cerberus. We've got 18 particularly personal close contacts of the individual concerned, and we'll get their results fairly soon. And as I mentioned earlier, one of the positive cases, the gentleman who is a staff member at Trinity Grammar, also attended the Wallabies to France rugby union match on the 13th of July at Amy Park. We will be issuing guidance for people at Amy Park. We're working with them to understand where people were in the ground. Again, as we stand here today, if you're at that match, if you have any concerns about your health at all, we want you to go and get tested immediately, please. That whole message around testing remains as important as it has been over the last year and a half. We see time and time again how important it is that when people get tested, that's often their first time that they realise they've got COVID. Please do not wait for symptoms to get worse. If you've got any kind of symptoms, we want you to go and get tested. 33,000 people did that yesterday. That's a strong number, but of course, given the importance of getting as much information as we can during the lockdown period, we want as many of you as possible, if you've got any concerns, to get tested now. We've added a various number of additional sites, including sites at Bacchus Marsh, at Ballan, at Chadstone, Craigieburn Central, Heidelberg, Latrobe Uni. We had good numbers there yesterday. We'd like to see good numbers there again today and over the next few days. 54 of our testing sites have also got extended operating hours to give people as much options to get tested. What we tend to see is they're busy in the morning, they're a bit quieter in the afternoon. So if you're deterred in the early morning by the length of the queue, please go a bit later. And I think, as we've said before, bring something to divert you while you're waiting for your time in the testing queue. We have 4 additional testing sites today, including at South Barwon Reserve, at Cheltenham on the Nepean, and at Monash Health on Centre Dandenong Road. Finally, on vaccinations, vaccinations remain as important as ever, of course. 17,000 people just over were vaccinated yesterday. We have some first dose Pfizer appointments available, and again, if you're eligible for Pfizer vaccinations, I'd really urge you to try and make an appointment. There are over 12,000 spots available over the next 10 days across our 78 state clinics, and there are still 27,000 spots available for those who are eligible for their second jab of Pfizer. So if you started your Pfizer journey, you're due to get your second jab, we'd like you to do it as soon as possible. We also have 14,000 doses available that we're working on with priority communities. Really, as we are now on the first day of this lockdown, we know it is challenging for everybody. It is not the place that any of us wants to be in. So please do follow the lockdown restrictions. As you can see with the pattern of exposure sites we have, we've got multiple schools. We've got a large physical territory to the west of Melbourne and across Melbourne. We have a number of important leads to follow and some very big exposure sites across the network. Please get tested if you have any symptoms whatsoever, and if you have to isolate, please follow those isolation protocols. And if you need any support or help, if you're not clear, please contact us. We will do what we can to help you. With that, I'll hand back to the Premier.
And again, can I thank everyone who got tested yesterday and everybody who will do the same today. It's critical that anybody with any symptoms, and particularly those who are directed because of their exposure to others, to get tested, that they go and do that. It's a massive contribution that you make for all of us. Can I also extend my thanks and best wishes to those many thousands of Victorians who are at home, isolating away from others because of who they've been with and the places they've been to. That is not just about keeping your family safe, it's about keeping every family safe, and we are deeply grateful to each and every one of those many thousands of families who are contacts and are doing the right thing, staying at home, protecting all of us. I'm happy to take any and all questions you have.
Any of the cases from the MCG known to each other?
I think you're right, it's probably best to do this.
So both cases at Young Jackson's are unknown to each other and did not know the index case who was there with his friend. The 4 individuals who are identified today who are at the MCG, again, they did not know each other. They did not sit directly with each other. They did not know the index case or his friend. Yes, so there's
that's why the senior ministers within the cabinet and cabinet more broadly will be meeting, discussing these things. We'll be getting regular updates. It's too early for us to predict where we'll be on Tuesday, but having acted quickly, having taken that decisive action, as difficult as it is, early, we are much better placed to be out of this quick, not without pain, no one's pretending that, but a shorter lockdown rather than a much longer one.
If at the last day of this lockdown we still have stranger-to-stranger transmission, even though it's linked to the existing outbreaks, will that cause you to extend the lockdown?
No, I'm not in a position to be able to give you a definitive answer to those questions. We're not at the last day of this lockdown, and what's more, if the method of transmission will be less relevant if the people that have become infected were at home, if they are in ISO. So it's not so much the circumstances of the transmission. It will be much more, are the people who have become positive that are infected, what was their status? Were they out and about or were they at home? That's why lockdown is so important. It limits movement and it allows our contact tracers not so much just to keep pace with this virus and this strain, but to get out in front of it and to ultimately crush it, as we did just a few weeks ago.
The Prime Minister and the federal government accused the state government earlier in the week of whinging, but did it actually, the whinging, so-called whinging, actually work because you got what you wanted?
I'm very glad you added the term so-called in there. Look, as I said yesterday, my job is to stand up for my state, each day, every day, and I'll always do that. What I sought to do during the course of this week was to remind the Commonwealth Government that they've always said that their programs are needs-based, and there's a need here, so pay here. And if there's a need in another part of the country, then they should pay there too. I wouldn't read too much into some of the back and forth this week. It's important sometimes to make sure that everybody understands where you're coming from. That's what we did this week. I had a very productive discussion, in fact several discussions last night with the PM, and we were able to confirm those arrangements. I think they were announced by the federal government, as is appropriate, last night in a statement. And the Prime Minister and I will take the opportunity to brief our First Minister colleagues on exactly what the deal we did when we get to National Cabinet.
So it paid off, in other words, going in hard early on that.
Others can make the judgment about what the dividend or the yield was. Be really clear about this. I will never stop fighting for my state. That's what I do every single day. Whether it's polite, whether it's doesn't matter. Like you just get the job done. So I will continue to fight for more for Victoria. That's a really important part of the role that I have.
How much are you expecting to pay for the areas that aren't hot zones? What are you sort of budgeting for potentially?
I need to come back to you on that. Obviously, it's not something we've been able to run through to get those numbers in any definitive sense. It'll be in the running. We'll probably have a clearer sense in the next few days. But that's going to be administered by the Commonwealth. I think it'll be incredibly difficult if we were trying to run JobKeeper 2.0 and they were running JobKeeper 2.0. So they'll run it, administer it, and we will pick up the tab. They'll send us a bill, and we'll move on from there.
Was last night's commitment
Saving the sole traders and the business support packages?
So sole traders that are registered with the GST, yes, they're part of this, and that's a really important part of providing support.
Was the commitment last night from the federal government effectively a concession from them that they didn't give Victoria what it needed during our last lockdown?
Look, I'll leave others to make their own judgments about that. I'm not here today to have a quarrel with anybody other than with this virus. That's what we have to be united against, and that's exactly where we find ourselves. I didn't think it was appropriate to have this arbitrary 7-day and almost incentivise a longer lockdown. But at the same time, to be fair, the Prime Minister wasn't to know when he made these announcements yesterday, I think, or the day before, that our public health advice would recommend a 5-day lockdown. So you just work through these issues. You do it in a spirit of that common challenge. That's exactly what occurred last night. Yes.
When do you think that might actually happen? If it's only 5 days, we're into the first one now.
Yeah,
will do this weekend, or?
Look, I can't predict now, and it may not be possible. If I don't get advice that says it's safe, then I simply won't do it. But if we see as more and more negative tests come through, as we run down more and more of the leads, as it were, if chains of transmission come to an abrupt end, then it may well be that some of the far-flung parts of the state we don't have a case, and under those circumstances wouldn't have a link to a case, it may be, in the view of the public health team, safe to let them open up. If I can do it, I will. I know and understand. I've said this before. I personally, I grew up a long way away from where I'm standing here now. I know what it's like to live in a community that's 3-4 hours from Melbourne, and I can only imagine how frustrating it must be to be locked down when cases are that far away. But we can't take a risk of either A, people fleeing to a place with better rules, as it were. That would not be good, potentially taking the virus with them. And we also can't assume that we know everything about this outbreak, because there's always something you don't know. That abundance of caution has served us well. We have kept this out of regional Victoria largely. That undoubtedly has saved lives and has meant that in aggregate, regional Victoria has been locked down and dealing with the challenges of this virus in their worst sense for a much shorter period than would have been the case. If we can, though, if I get advice that says, right, they can open up, we will do that. But I don't have that advice yet, it's too early.
Are there regional areas?
This weekend, considering that possibility of people leaving Melbourne and driving out?
I'm not going to make a judgment either way. All I'm going to say to people is I understand how challenging it is. We are looking to try and do something different if we can, but at the same time, I don't have advice to open up any part of the state until, at the very earliest, midnight on Tuesday. But if I get that advice that it's safe, particularly for areas that are a long way from Melbourne, then we won't hesitate to do that. But I don't have that advice now, Michael, and when I get it, you will be literally briefed on it very soon thereafter.
Are there regional areas at the top of that list that you can safely say you'll open up first?
Well, I think you can look at areas that don't have cases at the moment and areas that are a long way from Melbourne, where I think the frustration will be greatest. But at the same time, this is not a mission to be popular. This is not about, seeking praise. It's about getting the job done. If we can safely release some of those communities, we will. I can't say any more than that. But I thought it was appropriate last night and again today to be clear with people in those communities that we are working toward that outcome. But if it's not safe in the view of the experts, then you won't see me do it.
Last round of business support, businesses that weren't registered for GST under $75,000 missed out on support. This is automatic payments to those who qualified last time.
Correct.
Will you provide support to those businesses under 75k?
I can't announce that today, but we are having a look at that.
And also businesses that applied last time that missed out,
yes.
What support are they going to get? Because they're still crying out for support.
Yeah, well, just a couple of points. I was asked yesterday about payments that haven't been made, right? Let's just be clear about this. If on the paperwork you're not eligible, then we can't, in good conscience, pay you. We have to work through those issues, and we do work through those issues. And even though we've got the vast majority, like 400 plus out of 460 million is out the door, there are still many thousands of businesses who have applied, and we're working through those one by one, and that is the appropriate thing to do. And we'll get those payments made as fast as we can. In terms of this money, those who were eligible, and obviously they remain eligible because it's only a few weeks later, we will be pushing this money out as soon as possible. So there's every chance, and our aim is to have this money in bank accounts, or at least we've played our part in that. It does depend on which bank you're with, but we will have pressed the button on the payment going to you, hopefully before this lockdown actually ends, which is scheduled to be, we are working towards midnight Tuesday. In terms of whether you're eligible or not, there will always be people that fall on either side of a line, just like the...
Can people reapply, I guess, those that missed out last time?
Yes, absolutely they can, and we'll look at every application on its merits, but I don't want anyone to be confused. If you got a payment last time, you do not need to reapply this time. You will get an automatic payment, and that's the quickest way in which we can get support to you. But we acknowledge that whenever you, just like the Commonwealth program we've been talking about, some people will be eligible, some people won't. Those who, for instance, it's 8 to 20 and then 20 and above in terms of hours lost. Some people will qualify, some people won't. That's why we have some other generic supports. That's why we always try and provide support, particularly to those who are the most needy. But again, this won't be the end of the support we provide. This is what we're doing right now. We're always looking at these things, Rich, and we're always looking to do more.
New South Wales is offering a payment, I think, for business between $30,000 and $75,000. I think it's about $1,500. Is that something you're looking at?
We're looking at the issue. So as soon as we've got anything to say on that, we will.
And I guess a lot of these people will be desperate to get some assistance.
And many of them will be eligible for the announcements I've just made.
Well, I'm talking about the people who aren't qualified. So.
Well, hang on. Yeah, but let's not just jump over the fact that there will be significant numbers of people who do not qualify because, for instance, they are not registered for the GST, who will qualify for what I've just talked about, which was if you are down 8 to 20 or 20 and above in terms of hours over the 5 days, there is a Commonwealth payment for you. If you're outside the Commonwealth declared zone and you're in regional Victoria, we will pay so that everyone's being treated equally. I don't think we should just skate over that. I don't know how many people that will be. We won't know ultimately until we get the bill from the Commonwealth who are administering it. But that's not nothing. But the broader issue you raise, we are having a look at that, and if we have more to say about that, then we will.
Premier, we heard this morning that interstate removalists from red zones could be banned from entering Victoria for 2 weeks. Can you provide us a bit more detail about that?
There's been a number of changes made in relation to permits. The freight industry, I want to thank the freight industry for agreeing to additional testing, to just playing their part, as they always have. They've kept the freight task moving around our nation these last 18 months, and to truckies and to those who work with them, and we're very grateful. However, if you're coming from a red zone moving furniture, no, you aren't. So we think that's the appropriate thing to do. If you would like us to get you any more details about that, we're more than happy to do that. It's just a change that we can make, particularly as things, I think, become more unstable and more challenging in terms of more case numbers coming out of Sydney.
Which kind of removalists does that apply to?
Let me come back to you with the details on that. Yeah, so we want people to be tested every three days, and we think that we'll be able to get that outcome. And again, I just want to say how grateful we are to the transport peaks and to all of those companies. The other thing too is that sometimes the freight can come, but you've got to find different staff that haven't been in that red zone. That's challenging, but we're very grateful to everybody in the freight sector who, again, let me just say, they've done an amazing job all through this, and I'm sure that as we call them to do more. And I would just point to the fact that South Australia have made some of these changes as well. I'm not sure if it's on the agenda of a National Cabinet today, but I would think that all states will ultimately pick up some of these changes and work with that freight industry just to make sure that we're keeping everybody safe.
For other workers that are coming in, why not introduce that to get a test before they come into Victoria and that extra layer of security?
Yeah, I wouldn't rule that out in the future. Just have to wait and see. Yeah, and I could pretend that we're our own nation and, build a wall. There's all sorts of things you could do. Ultimately, if you're going to have any movement whatsoever, that is to say, if you're going to live outside a permanent lockdown, there's always an inherent risk. Our challenge is to find that balance point, and I'm absolutely certain that Victorians will rise to this challenge as we have done before. We will get ahead of this, not just alongside it, not equal with it. We'll get ahead of it. We will crush it as a community, as we've done before, and then we'll be able to open up. But I'd always say to you that no matter what the measure is, we're constantly looking at other things we can do. Our response has to change over time. It can't be static because the virus isn't static. What might have worked last year against a different strain may not be effective or as effective as necessary against this Delta strain. Things twice as infectious. These last year was a lot about mystery cases. Now it's about, fleeting transmission, people who don't know each other, haven't even registered that they were in the same space together. It is an evolving thing, and therefore some of our responses have to. So I can never rule out changes in the future. We look at that every single day.
Transmissions of the MCG, we had this person who was in the rugby union as well. Thankfully, no cases there so far. But do you think, considering the Delta and everything else, will you re-look at how those major events run in terms of crowd capacities or how you space people?
Well, firstly, I'd say to the operators of those large sporting events, I want to thank them for the venues, the QR system, the processes they put in place have been absolutely fantastic, and they make the job of our contact tracers. It's never easy work, but a little bit easier, so we're very grateful to them. I just want to make sure that every Victorian understands that I don't set the crowd limits at the G. There's a panel, there's a process, there's a team of public health experts who make that very difficult judgment to balance risk. So some might say too many at the footy. Others last week were saying there weren't enough. So there'll always be that balance to be struck. Obviously this weekend and for the period of the lockdown we have no crowds. We want to get back to having a crowd there. But again, just as we were, we will again be guided by the advice and the expert opinions and the hours and hours of work they do to get to that balance point where the risk is manageable and we can get as close to normal as possible. The alternative is the kind of never-ending permanent lockdown. I don't think any of us want to do that.
There's a ban on removals now for 2 weeks. What's your advice to people from interstate that are meant to be coming to Victoria?
My advice to people from Victoria who are in New South Wales is for 3+ weeks now we've been respectfully advising you to get home or run the risk that the rules change. And I'm not admonishing them. I'm not doing anything other than being clear. We have said please come home because the rules can change. The rules have now changed, as we foreshadowed was likely. Even if you do come, you need a permit, and you need to comply with each and every term and condition of that permit. So whether it's in fact, it's all red, the whole state. So it's 14 days. Now, many people will choose to defer returning to Melbourne. Some have already come back, and they've perhaps got in under different rules when some parts of New South Wales were orange. Again, I don't think no Victorian wants to.
But what about those families that are meant to be relocating? They're not necessarily Victorians. It could be someone from New South Wales that's meant to be moving here. What happens to them?
Well, we're in a global pandemic. I'm terribly sorry. I cannot provide any other answer than that. We're in a global pandemic, and yes, there will be significant burdens on many people, but we'll get through this, and then the rules will hopefully switch back to where they were. And we'll always look to work with individuals and to work through their circumstances, and that's where the permit system, which is sometimes seen as a bit harsh, but the permit system does have opportunities for an individual circumstances to be taken into account. I'll come back to you with a bit more detail about that. We don't want to be unfair, but we just have to be very attuned to the fact that this is wildly infectious. And Sydney's over 1,000 cases now. We're doing everything we can to avoid getting to that place.
From you, with all due respect, this was a decision that was made because people did the wrong thing. What about the people who've done the right thing up until this point? People are ending leases, they're selling their houses, they've already started that new journey. How are they supposed to do that?
Well, there will be consequences. And again, I'd say to you with the greatest respect and to those individuals, I am doing everything I can to make this a short lockdown, have it as an outbreak, not a wave, and that will mean that some people will do it tough. We will look to support them as much as we can. I'm not wanting to appear flippant on that. I understand that there will be pain, there will be challenges for people. We'll work with them, and there may be other arrangements we can put in place. They may need to put other arrangements in place, but we'll work with anybody who's impacted, and that's where the permit system is actually a friend for that, if you like. It's about trying to work through the individual circumstances that people have. Well, if they would need to apply for a permit anyway, and there are mechanisms where they can explain their circumstances, and we can try and work through with them on a case-by-case basis. But again, we need to limit movement within Victoria, and we need to limit movement from New South Wales, and that's just the position that we find ourselves in.
Don't you think Victorians should be given an informed decision of what removalist companies they support in future?
Well, what I'd say to you is that police in 3 states, as I'm advised, are looking into those matters. So I'll leave that work to them. No, police don't brief me on what they're looking at. As I understand it, police in 3 states are looking at them. Certainly Victoria Police are, because they've been referred to Victoria Police by us. No, they're not here now, and they're not getting back in. So there's no purpose served. From your point about trying to protect the community from perhaps using that company, there's no purpose served by that, given the rules that we've changed. You potentially, but again, I don't want to cut across what is an active police process. I don't know what the outcome of that will be. That's the nature of our system. Politicians don't do that work. Police do, and that matter's been referred to them as is appropriate.
Is it a to lie through or obstruct contact
Yes, it is, potentially. And what I would say though, just so that we don't lose focus, the vast majority of people have done the right thing. They tell the full story, and it helps to protect all of us. And I'm very grateful to people who, in the telling of their story, have made admissions. They've been very frank, and that can be quite an unpleasant and challenging thing to do. But we've had literally thousands and thousands of people who have been upfront and have served a much greater good. And I've been asked this question before, you know, why didn't we fine somebody for visiting a loved one which was in breach of the orders, right? Going out, not one of the 5 reasons to leave. The story they tell us, the information we get, is worth so much more than a $1,500 fine. So I just want to make it very clear to anyone who's positive, anyone who is contacted for the purposes of contact tracing, all I want is your information for the containment of this virus, not any other purpose. However, when it comes to some people who've been just flagrant, like these people, it is appropriate that there's a process. That process has meant there's been a referral, but I wouldn't want anyone deterred from telling the full story. All we want is the information to try and stop the virus, nothing else.
And police said those people are those removalists or the company at least are now being helpful. South Australia said that they were apparently being helpful to them.
Very pleased with South Australia that they have been.
Is there anything else? I do note that we interviewed them before New South Wales and South Australia would appear, or at least published exposure sites from them. But is there anything else?
Thank you for that acknowledgement.
Is there anything else our contact tracers could have done differently so that it didn't take us 48 hours to get them to tell the truth?
I don't think so.
And was it helpful, I guess, this is probably more a question for Jerome, for him to sort of publicly talk about how unhelpful they were being while we were still trying to seek information from them?
No, I don't think that the two issues were linked. When you're speaking to people, there are often many barriers, and I don't want to be making any observations culturally or linguistically or any of that. Everyone's dealt with this as a individual person, but this was a complex matter. It was not easy. I think our contact tracers did the very best they could, and I'm delighted that some people who were not necessarily as cooperative with us as we would have liked are being more cooperative with other states. I think that's terrific.
Do we know what the barrier was when they were talking to us? Why were they more forthcoming?
Without, I think, leading to people drawing conclusions about a group within our community, a language group, for instance. I'm not going to speculate, but it was not a function of that. But sometimes it's easier to communicate with people than it is with others. But I wouldn't read anything more into that, and I'm not about trying to fuel that by kind of singling out any particular group. Everyone is different. Everyone has different circumstances, and some people are easier to get information out of than others. I won't go any further than that for fear that people draw conclusions about an entire group within our community, and I just don't think that would be fair.
With all the multicultural media right now,
Pardon, sorry?
is there a need to include the multicultural media?
We have. Well, I would just point out that any multicultural media spend that we did wouldn't have impacted these people. They're from another state, right? So that's the first point. The second point is we have a deep engagement, and I am deeply grateful to faith leaders, cultural leaders, people from across our brilliant diversity who have been nothing short of amazing over these last 18 months, reaching into communities as trusted voices, reassuring people, making sure that positive messages and positive behaviour was a feature of last year and has been a feature of this year. We spend a lot of time and a lot of money engaging with communities using every medium possible and being as specific and as targeted as we can be. There's no complaints there, there's no fault to be found there, but it's an ongoing thing. We keep engaging as deeply as we can.
The AFL moved their clubs out of Victoria before the lockdown announcement. It's not the first time that's happened. Are they being given a heads up before the public is about lockdowns?
No. Look, any suggestion that that's wrong? Simply wrong.
You said yesterday that you would have further to say on elective surgery.
Yes.
Has there been any...
On advice from our public health team in consultation with their clinician colleagues who do the surgery, elective surgery is continuing, and that's the advice. And level 3 PPE is being worn by all of those staff who are engaged in that surgery. Obviously, there are limited lists on Saturdays and Sundays, but at this stage it is continuing unchanged. If advice about the safety of that were to change, then we would announce a different policy setting. But my advice, as of literally half an hour ago, is that the view of the experts is that it is safe to continue elective surgery, and on that basis, elective surgery is in fact taking place. Are any of these 24 cases in hospital?
Yeah.
So no is the answer, and if that changes, we will provide that in the usual way.
And do you know if any of these cases were vaccinated?
I don't have that information. We can try and provide that to you offline, notwithstanding privacy and all sorts of other issues.
On major events, if you get towards the semi-finals, Melbourne Cup cricket at the end of the year, do you think there's a place for making it mandatory to be vaccinated before going into one of these big events like they've done in places like the UK?
Look, Michael, I think it's important just to take a step backwards and just say, okay, right, here's a set of rules in the UK. Have they got sufficient vaccine supply so that everybody who wants to get vaccinated has had their two shots? I think they've certainly got more supply than us. So the notion that we would start mandating things well before we could actually vaccinate people, that might not necessarily be fair. The good news is, though, come September, if you understand the point I'm making, at the moment we have many more people who want to get vaccinated than we have vaccines for. I don't know that that's the case in other parts of the world where they've slapped these rules on to say if you haven't had your 2 jabs you can't come in. We'll get to that point maybe where your vaccine is a kind of passport to do things, to be involved in certain activity. I don't know, wouldn't be a Victorian thing. I think we'd try and get a national framework there. That's some of the modelling that's being done by the Burnett, by the Doherty, and some of the things that National Cabinet will consider in the weeks and months ahead as part of that four-step plan. Once we reach the peak vax number, whatever that number might be, and then try and push beyond that, noting that everyone who's not vaccinated will be at grave risk of becoming very, very ill once we return to normal and we start really opening up.
How many people were out infectious in the community in those case numbers? Is that a stat we can get with the daily case numbers in the morning from now on?
Let me ask.
Looking at the AFL, often the crowds, when even though they're capped, they're all pushed into certain stands. Is it time, particularly for someone like MCG, to get a cap of 25,000, to actually use the whole space of the ground to minimise risk like this?
Well, I think they by and large do. I mean, I was at the Carpage Long game, there were 32,000 odd and they were spread right around the ground. We don't make the decisions about the crowd configuration, but but they submit their plan and that's part of what's considered by the public health panel. So, I think it's appropriate to use as much of the space as possible, but and certainly it was the same at Amy Park on Tuesday night. I think there were about 20,100 and they were spread right across the stadium. So I know we saw something a few weeks ago at Geelong where people were pretty well packed in, but that hasn't been the case since then.
I've been to a few games where the top level is just closed off to a lot of people. Why not use that space?
Well, again, that's a matter for the MCG or for Marvel, but I'll certainly, I think if the AFL puts forward plans or the Melbourne Cricket Ground puts forward plans where the crowds are more spread out, that may lead to the public health panel putting a different microscope over it, taking a different view of it. But that configuration is not a matter for the government. The government will provide the AFL through the public health panel with a crowd cap. And I think it takes us back to the point. I remember when we were at 85% back in April, and people were saying, why do we have to do QR code checking? Why do we have to do this online ticketing? Why were we not moving to 100 when the Chief Health Officer said he wanted more data about where each and every individual was sitting? This is exactly why.
Say we'll only give you this cap of X amount if they're spread right across that area.
Well, as I said, the public health panel will assess the COVID safe plan that is put forward, and I have no doubt that the assessment that they make will be impacted by the configuration that's put forward. So if there's a configuration where people are more spread out, that may well allow the public health panel to be a little bit more generous than they might be otherwise.
Are you comfortable comfortable having them all piled into one particular area? Is that going to weigh on the decision around caps?
Well, they're not all piled into one area. It's the point I'm making. And as I said, the AFL and the games I've been to, that's not been the case. It's not for me to determine the caps. It's the public health panel that makes that assessment based on the plan that is put forward by whoever is the organiser, whether it's Rugby Australia, the AFL, NRL, and obviously, given that we've now had transmission at the game, I'm sure they'll pay even more attention to that.
How do businesses that missed out on support last time, how do they get access this time? I mean, if
well, as the Premier indicated, if you missed out on support because you're not eligible, you're not eligible. If you haven't made an application for whatever reason for the last round, and you've decided you want to make an application now, well, there'll be information on the Business Vic website about how you can do that. But we don't want to create a situation where businesses that don't need to apply all of a sudden believe that they have to. They're going to get the payment automatically.
Right. Sorry, we've been told that some boys said they had 48 hours notice of potential lockdown. Do you have any idea of how that would have happened?
Well, they didn't, because I didn't know that we were going to be making this decision till yesterday afternoon. I was hopeful right up till early yesterday that we might not be in this situation. Look, the AFL, like other sporting codes, are organisations that they plan based on risk, and they make, in the same way that they brought, I think, a couple of teams over from Adelaide a couple of weeks ago just in case, and then sent them back to Adelaide 48 hours later without having played a game. They make assessments of risk and they make decisions consequent on that assessment. It's not because they have forewarning or inside knowledge. They don't, and they absolutely didn't have on this occasion. I can, as the person who has the relationship with the AFL, the primary relationship with them, I can guarantee you they didn't.
Jerome, can we ask you, just for the sake of clarity, could you just quickly explain the 6 we did not know about today, where they came from, the 6?
Yeah, I think I'll be pretty clear. I won't do the whole repeat again. You can replay the tape. But the 6 we didn't know about today. So we've got 2 at Young and Jackson. We did not talk about those yesterday. The 2 men in their 30s. We've got 3 people who were at the MCG, so 3 other cases at the MCG, and we've got 1 personal household contact of the man at the aerial apartments.
Jerome, can I ask you about the man in his 60s from the apartment? We know he didn't do anything wrong. I think you've said before he didn't have symptoms. Is that correct?
That's right.
But he is something of a super spreader. If my maths is right, he's given it to not only his parents but 7 other people in a very short space of time. Is he being looked at as a super spreader?
Well, no, we wouldn't use that term. You're absolutely right. We've got 1 individual, the man in his 60s, who's been, again, exceptionally cooperative, as all the positive cases have been in this investigation so far, about his movements and where's he's been. We've got a full history of his movements. But you're right, he is uniquely been very, very infectious. We've seen a significant amount of spreads, given the public health team a lot of data, a lot of information. Professor O'Brien, who was here with us yesterday, has spent a lot of time going through his interview notes and understanding the nature of that. So we do see that. We see a lot of people who have no onward transmission at all, and we see occasionally cases like this where they're highly infectious. Rich, sorry.
I think it's 12,000 spots for vaccines available, wasn't it?
That's right.
Have they not been taken up, and is it time to, I guess, lower the age threshold?
As I said the other day, Richard, so we've released about an additional 30,000 doses of first dose Pfizer slots available over this week, next week and the week after. We've got 12,000 doses left over the next 10 days, so a little bit of this week's allocation, some of next week's allocation. So those slots are going fast. I'd encourage people, those of you over 40 who are eligible to get Pfizer, please come forward and get it done.
Does it get to a point if they're not being taken up by over 40s that perhaps many of the people here
Look, I think that's
in their 30s might want to get it?
Yeah, that's good.
Eligibility will be a national thing. It's not for us to be changing the eligibility frameworks. We need to be doing that consistent with the national vaccination rollout. This is a Commonwealth program. We're helping out, playing our part. I think we remain the highest number of jabs from state clinics of any state or territory. We're keen to continue playing our part. I would just say to people, getting vaccinated is one of the 5 reasons to leave your home. If you've got a second AstraZeneca jab booked or your second Pfizer jab booked, please go and get that done. It's very important for you and your family, and ultimately it's important for every single family. As to who becomes eligible, supply, additional vaccine activity within that program, either GPs, community pharmacies or state clinics, that really is a matter of national priority, national decision making. And we'll get a vaccine rollout update, I think, from General Fruin at National Cabinet today.
Your view that should be open up to more people, or you can take that to national level?
Not necessarily. I'd be guided by not just what's on hand today, but it's about this is a big, complex logistical task, and it's not just having one. You've got to have some confidence that you're able to complete the task. So you've got stock now, and you'll have stock in the future when the person becomes, or many thousands of people become eligible, and need to have their second shot. All of those things. It's not something that I think can be done at a press conference, but Victorians and Australians can rest assured that, certainly Victorians, we're doing what we can to get as many jabs into as many arms as possible. There's no constraint on staff. There's no constraint other than the amount of supply. And let's hope the commitments that have been given around a big spike in supply of Pfizer and Moderna and those arrangements, those horizons that have been well canvassed, all come to pass.
On the AstraZeneca, Target released this advice this week based on Sydney on shortening the time for your second dose if you're in an outbreak, was their term.
Yes.
What's the threshold for an outbreak? Are we not in one, and is this another example of confusing advice around AstraZeneca?
No, I wouldn't put it to you that way, but I've been asked my view on AstraZeneca, and I have been consistent. Go and talk to your GP. I'm not a doctor. I'm not here to provide medical advice. I'm not here, can I say with respect, to interpret what a target has or hasn't done. I think Victorians know that you won't find a better health professional than Alan Cheng. You just won't. So they take their responsibilities very, very seriously. And if you want further advice or interpretation of what they've done, I direct you to them, and I'm more than happy to follow up for you, but I'm not going to be here interpreting what they've done. I will, however, make the point, if you're booked in for your second AZ shot, if you didn't have a reaction the first time, then the advice is you're not going to have one the second time. Please go and get that second jab. What's more, if your doctor says it's safe for you to have AstraZeneca, we do have some supply, and GPs have some important supply. If you're eligible and your doctor says it's okay, then go and do that. Again, I'm very careful with the messaging on this because I'm not a doctor. What's more, I think that it remains the case. There are many more people who want to get vaccinated than can get vaccinated because we don't have the stock. That's a matter for the Commonwealth Government. Let's hope that changes soon.
So your stance and the government's stance on the second dose and the timing is that it shouldn't change. It should still be 12 weeks.
No, I wouldn't. No, So you've put one thing to me and asked me to interpret that and have a view about that. I'm not a doctor. I'm not going to do that. That doesn't mean, with respect, that you can infer that the opposite of that view is the government's view. That's our view is we'll follow the ATAGI advice. If you want me to help chase up some of the reasons behind that, or to answer this question about would a ATAGI view what we're going through at the moment as an outbreak or something else, I'm more than happy to do that. I'm not having a quarrel with you. I cannot and I won't provide medical advice or anything that might be seen. We've got to all understand there are some out there in the community who anything I say on this matter, people who don't believe this virus is real and who have some pretty strange views. So I'm always very careful when it comes to talking about these matters. Some of the people who were out protesting last night, which was shameful, and if they try it on during lockdown, then police will deal with them. We all should be protesting against the virus by following the rules. That's what we have to do, not some of the stuff we saw last night.
So the answer to lockdown, I think it's going to say a lot of Victorians are emotionally weary when it comes to lockdown, but do you sense that there is more support for this one, given especially what's going on in New South Wales?
Look, I think Victorians, having been through all that we've been through, we know and understand that this works. We know and understand that we had no choice, and we can see, not that we needed to see it because we've been there, but we can see it unfolding in real time. We can see what 1,000 cases looks like, and we don't want that. So I think Victorians, as painful as this is, we know and understand how to get this done, and we're all signed up. It's not easy, and that's why we're announcing big support. It's why last night I was able to come to an agreement with the Prime Minister about support for some of those paid work, for those losing, work as hard as we possibly can possibly can. I'll just stress, we can all work, night and day, but every Victorian has to kind of do the same thing in following the rules. Everyone has a part to play. Get tested if you've got symptoms. Isolate if you're asked to isolate. Don't go out. Only go out for those 5 reasons. Do the right thing. These rules are well known to every single Victorian. And what's also well known is that if we follow them, it works, and we can drive these cases down to a very low number, and we can get back to something approaching normal.
Is there going to be a gradual release from lockdown?
Pardon?
Is it going to be a gradual release from lockdown? It took a month to get up and running.
I'm not sure whether, I was certainly ready to answer this question last time. I'm not sure whether we got to it or not, but look, we will try and get back to normal as quickly as we can. It's too early to foreshadow exactly what will happen on Tuesday night for the reasons I've mentioned before, but we want the greatest freedom as soon as we possibly can. We see the unemployment rate, very good numbers for Victoria. We're very pleased with that. We've seen a big surge. That's not being boastful. We've got a long way to go, and our jobs plan, as represented by our budget last year and our budget this year, is working. There's a lot more to do though. We don't want that economic recovery. We don't want those jobs and the certainty and security that they provide for families, every family. We don't want that interrupted any more than absolutely needs to be, and that's why we'll have hopefully some positive news early next week. And it's then that we'll know more about how we move to the next phase, whatever that phase might be.
And lastly, on that removal list decision, can Victorian removalists enter New South Wales and return without having to quarantine?
Given the interest in this matter, I'm going to come back to you with a detailed copy of the rules so that there's absolute clarity about that. As we've done on many occasions, it's always good not to make anything up from the podium, so certainly not those issues.
When that's starting?
Sorry?
When is that?
That's already started. Some of those changes with freight have already started, and we'll come back to you with the exact wording on those changes in policy. There's one for Jerome.
Yes, it's not that exciting, but I'm going to ask it now anyway.
Exciting question.
The MCG, we were going to look through the CCTV footage yesterday. Has that been done? Are there any, toilets or entrances that all those people walked into at the same time?
Well, we don't have cameras in the toilets, but there has been a huge.
Was exciting.
It was worth it. There's been a huge amount of CCTV review done, not just at the MCG, but also at the vast majority of these exposure sites. Young and Jacks, all these other places, we're looking for any evidence we can find to understand people's movements, and particularly what those overlapping those contacts are. So with MCG in particular, absolutely, we've seen some trips to the bar. We're looking for adjacencies there. We've seen some trips around the ground. We know that the index case in particular made a number of movements. We're watching those very closely. We also use CCTV to try where we can to identify other people that might be of real concern. So who else they've been in close contact with. So there's a huge amount of forensic information. Again, my thanks to all those businesses that are involved. 126 exposure sites. A lot of work in the transport sector at the moment in particular to try and trawl through as much information as we can to get hold of people and to contact them. Nick and then Rachel.
So what happened at the Royal Melbourne Hospital? Is that just sort of a microcosm of how easy these things can really create problems?
That's absolutely so. Just for a brief background, so an individual who turned out to be a positive close contact of our positive case was treated at RMH yesterday, I think, for a scheduled appointment. That in turn has led to the RMH activating its own COVID response plan, so around 200 staff furloughed. I'm pleased to confirm that the individual, the patient, has now tested twice negative for COVID, once yesterday and again overnight. So that gives us some reassurance around exposure at RMH, and RMH will work through the normal exit process from that process. But it highlights, and again, as the Premier said, with elective surgery underway, and of course we're very aware, very alert at this moment in time, particularly for our most vulnerable settings. Please, if you are going to a hospital appointment, a healthcare setting, because you have an appointment to be there, make absolutely sure that you are not in an exposure site. Make absolutely sure that you're not a primary close contact, that you've not been contacted by health. Don't second guess it. It is so important because of the consequences we've seen yesterday. It looks like it was a close call, but we're alert for these things. Rachel?
Just on Young and Jackson, obviously at the MCG we've got a very good handle on who was there because it was a ticketed venue. We even know where people were sitting most of the time. That's not the case at Young and Jackson. How many, are you confident that the vast majority of people who were there used QR codes? And I guess, given that those cases took a bit longer to emerge than the cases with the MCG, even though it was the same time, how worried are you about the potential for that also to be a significant point of spread? Yeah, look,
it's a significant point of work for us. So we have 207 primary close contacts identified for Young and Jackson. I think we've seen some really good numbers coming through the QR code system. And going back to Minister Pakula's comments, that QR code system is an absolute, it's a foundation stone of this really swift, fast contact tracing that we're now doing here in Victoria. So please, again, I urge everybody, if you haven't been doing it enough, do it more, particularly as we come out of lockdown again in a few days' time. We must use the QR code system as a critical way to speed up our response, because we can see how fast the virus works. We are, again, so we've put a public call out. We started talking about Young and Jacks a few days ago. Again, I urge everybody to go back to your memory banks if you were there at that time window. Please come forward now. It's never too late to come forward. We are focusing in particular on exposure sites where we've seen transmission already. So Young and Jackson, MCG, obviously a couple of the schools. Those are the real focal points for us today and the next few days.
Right. On last question, are you aware there's a report that a second child at St Pat's Murrumbina has tested positive?
I'm not aware of that. I mean, we do see from time to time, we saw it last night, that the Bush Telegraph starts to work pretty quickly as obviously concerned parents in the school community report possible cases or not. Some of those turn out to be true, some of them turn out to be false. So look, I really encourage people at this time to reach out to each other, to share information that you've got. Just be aware that it takes sometimes a few hours for the picture to settle down. So I'm not aware of that one. Doesn't mean we would expect to see during the course of today more cases, given the huge amount of work we're doing, the huge number of people coming forward for testing. So we'll update as we always do during the course of the day. Yeah.
Right. And were there any more breaches in isolation?
No, not that I'm aware of.
You're right, both the MCC and Amy Park.
I don't have the details of that with me at the moment, Mitch. I know we've got over 3,000 primary close contacts. When I stood up here, that number will have ticked over a bit more in the last hour or so. I'll come back to the detailed numbers. We certainly reached out again to those registered holders of tickets at the MCG yesterday, particularly that MCC member stand, as we broadened out our Tier 1 exposure site with the 4 new cases that came through.
Jerome, with contact tracers.
We do. I don't have that chronology detail in my head. My understanding is late morning to early afternoon. They were there for about 4 or 5 hours.
With this new Delta strain, how quickly do contact tracers believe a patient goes from an exposure to then being infectious themselves?
Yeah, look, and the evidence of this is different, and we've heard, in recent, in fact, over the last few weeks, we've had, Brett, Dan O'Brien, and others in our public health team talk about this. We've seen examples where we've seen spread within 24, 48 hours, where from exposure to onward transmission has been as short as 24 hours. That doesn't mean it's in every single case, but that's the kind of speed with which we're seeing this. As I said yesterday morning, we've seen 7 rings operating within 72 hours, the first 72 hours of this outbreak. It can jump through some of those rings very, very quickly indeed.
We've had a report that some people who were in the Percy Beams bar last night were notified they were Tier 1.
Yep.
But this morning they've received messages saying they've now been classified as Tier 2.
Right.
Can you clarify that?
Could be the result of a negative test result of somebody who was close to them. So what we do when we have a primary close contact, we then try to work out who their secondaries are. We've had a number of revisions of the zones of movement around the MCC. I mean, given we've now got 6 cases of COVID in that MCC reserve, in that level 2 area, that picture will continue to evolve. And as we always see with our positive close contacts and our tiers, we go wide as much as we can. Sometimes we have to go wider, and then we'll narrow down.
So people involved in that then should contact the...
Yeah, absolutely. And when we provide information to people, we always give them say, please get in touch with us on these numbers, on these details. We're building those relationships, and we'll work with them to make sure they get it right.
Can I just add, and perhaps if there's any other issues, people will get information. The information you get may be different to the information somebody else gets because it's based on your individual circumstances. The information can also change based on a negative test of somebody else that essentially changes your status because you weren't exposed to someone or in the company of someone who was positive. When we told you you were different, we thought you might have been. All of that's about being as personalised, as targeted, as localised as we possibly can be. And we obviously that's one of the ways in which you pull it up, as Jerome said. Individual personalised information based on your circumstances and a wide net that sometimes becomes narrower. That's the system working as it should. And we're deeply grateful to everybody who's contacted and does the right thing. It's a big thing, and we are very, very grateful to them. And the compliance is overwhelming. It's just terrific, and it's why we can look back with confidence and forward with confidence. We will get this under control. We absolutely will, because we've done it before, all of us. Any other issues, any other matters? If not, thank you very much.